Have you developed specific treatments for this?
Yeah, we have. So a lot of it is using those everyday activities. So we call it occupation-based rehabilitation. So it very much gets out of the therapy room.
Mm-hmm.
So I haven't done rehabilitation just in a therapy room for a long time. So we actually go out to people's homes, their work environments, their local community, and we design activities that are challenging but also feasible for the person to participate in. And we do a lot of performance prediction, where people predict how well they're going to go at different aspects of the task. We also provide timely questions and coaching during the activity so that people are noticing errors and challenges as they're experiencing them. And then afterwards we get the person to reflect on how it went. We show them videotapes. We might use relatives and other people to provide feedback. As well as supporting the emotional reactions and normalising and validating people's reactions. And that's often done in the first part of the program, and then the second part is more about, well, now that we're aware of some of these difficulties, why don't we trial some strategies to see if that can actually really improve your performance. So working both on awareness and self-regulation skills or coping skills.
Right. And how do you measure that your treatments worked?
Oh, right. Well, I guess we look for changes in awareness,
Yep.
which is something that you can measure using questionnaires.
Mm-hmm.
So you ask people to really rate their functioning or how they see themselves now, or to what extent they've changed since their injury. And you also get a family member or a clinician that knows the person really well to rate them on the same measure. And you're looking for just how closely aligned those reports are. So that's one way of measuring it. And then the second way is what I mentioned before about asking people questions throughout the activity. We're able to actually observe more non-verbal indicators of awareness. So when people are aware that they've made a mistake or that they've deviated from the instructions or the recipe, we're able to actually code those behaviours as indicating awareness. So it can be something like a swear word, or and so there's all these different reactions that people have, indicating that they're monitoring their performance. So that's another way of measuring it, is number of errors and corrective behaviours used throughout an activity. It's quite time intensive though.
I bet, yes, I bet. So, and tell me, how widely used is this training that you're implementing?
So the training is actually called Metacognitive Skills Training, and there's now been a number of studies done. Initially they were more case studies or pilot studies, but we've now got in the literature several randomised controlled trials that support the effectiveness of metacognitive skills training, as well as systematic review evidence supporting the effectiveness.
Right. So if a clinician out there, I would like to implement this sort of self-awareness training, what would you advise them to do to find out about it?
Yeah, so obviously knowing that something is effective, there's a big gap between that and actually knowing how to implement it. So we've written a few papers that actually break it down into step-by-step how you would administer the therapy that we found to be effective. So there's now some kind of protocol type papers for clinical implementation. And there is a treatment manual, but it isn't out in the literature yet.